Welcome to the Northern Territory Workers' Compensation Scheme. This short video will assist you in understanding your role as the treating doctor in the return to work process. In workers' compensation, your patient is referred to as a worker. A worker may choose their own doctor. If a worker is seen by a doctor chosen by their employer for the first consultation, they are still entitled to see the doctor of their choice for ongoing consultations. Your primary role is to provide the initial assessment, diagnosis and treatment. Treatment or investigations are not arranged by workers' compensation insurance companies, and doctors do not need prior approval from insurers or self-insurers. If you refer a worker to an allied health professional or a treating specialist, please note this on the worker's Fitness for Work medical certificate. Workers' entitlements include weekly payments, medical expenses, rehabilitation costs, pharmacy expenses, hospitalisation, and travel costs. A lump sum is payable if the worker's injury results in a whole person impairment of 5% or more. Once a worker has reached maximum medical improvement, you can suggest the worker ask the insurer to organise a permanent impairment assessment. This is paid for by the insurer and does not finalise the claim. Workers are required by legislation to provide medical certificates to their employer at various intervals. You may also like to watch our video on Fitness for Work medical certificates that gives further information about filling in the medical certificate. The Australian Faculty of Occupational and Environmental Medicine and the Royal Australian College of Physicians has developed a consensus statement on the health benefits of work. The longer a worker is away from work, the less likely it is the worker will return to work. There are many stakeholders involved in the process of helping the worker to achieve a safe return to work, and you may need to communicate with all of them, including insurer's case manager, worker's employer, vocational rehabilitation provider, if appointed. A worker is entitled to privacy during the consultation with their treating doctor. If a stakeholder needs to speak with you, they may organise back-to-back appointments or dovetail into a long consultation. Doctors may take into account opinions provided by stakeholders, however, should not allow these opinions to compromise their clinical judgment. The authority on the claim form signed by the worker allows the treating doctor to provide medical information about the worker to specific stakeholders. This authority applies to the injury related to the claim. If a worker is unable to return to their usual work within 28 days, the legislation requires that an employer give the worker a proposal in writing for a return-to-work plan. The treating doctor assists by reviewing the return-to-work plan with the worker to ensure it aligns with any medical restrictions. If you have any concerns about the plan, you can request the plan to be modified. If you or the worker have concerns, you can request the insurer arrange a case conference to discuss. Representatives at the case conference may include worker, treating doctor, treating allied health professionals, insurer case manager, employer, vocational rehabilitation provider. You can assist a worker to safely stay at work or return to work early, which can reduce the social and financial impact on the worker's life and well-being and increase the likelihood of a timely recovery. This can be done through early intervention and evidence-based treatment, facilitating rehabilitation focused on the worker returning to work, communicating regularly with stakeholders, focusing on the worker's capacity for work, recommendations for support services to help recovery and return to work, updating the worker's medical certificates. Sometimes the case manager will want an opinion or medical report from a doctor. The legislation provides for an initial medical opinion that the insurer must write to the treating doctor. The insurer is required to give you 14 days in which you can provide your report. If you don't, the insurer may arrange for your patient to be sent to a different doctor for an independent medical examination. This doctor provides an opinion only and cannot take over treatment of your patient. Northern Territory legislation does not allow an insurer to refuse to pay for treatment unless they have supporting medical opinion. The insurer is required to give a copy of the medical opinion to both the worker and treating doctor. At reasonable periods, the insurer may request the worker to see an independent medical examiner. Prior to this happening, the insurer must provide you with the name of the medical examiner and the date the examination is to take place. The insurer must provide you with a copy of the report from the medical examiner. Remember, treating doctors play an essential role in a worker's treatment, injury management, recovery, and return to work. Further information and help are available. If you have any questions, contact the claims manager or NT WorkSafe who can assist you.